Focus group discussion, a research methodology. Focus group discussion is a qualitative research methodology where a small group of participants gathers to discuss a specific topic or issue to generate data. The defining feature of this approach is the interaction that occurs on two levels. 1. Between the moderator and the group, the moderator facilitates the discussion, guiding participants through a structured dialogue to explore their thoughts, experiences, and opinions. 2. Between group members, participants share and exchange ideas, often building on each other's contributions, leading to richer insights. The primary objective of focus groups is to provide researchers with an in-depth understanding of participants' perspectives on the topic under discussion. This interaction allows researchers to uncover not only what participants think but also why they hold those views, how they articulate their experiences, and how social dynamics influence their opinions. Growing popularity in health and medical research. Focus groups are becoming increasingly popular in health and medical research due to their ability to 1. Explore complex social contexts. Health-related conditions are often deeply rooted in social environments. Focus groups provide a platform to examine how social factors influence health behaviors, attitudes, and perceptions. 2. Address sensitive topics. Issues such as mental health, HIV/AIDS, or sexual health are challenging to explore through direct, individual questioning. The supportive group setting fosters openness and encourages participants to share experiences and opinions. 3. Assess public perspectives. Researchers use focus groups to gauge public understanding of illnesses, health risks, and disease causes, which can inform health education and policy. 4. Evaluate healthcare services. Focus groups provide valuable insights into patient experiences, attitudes toward healthcare services, and the needs of both patients and providers. By leveraging group interaction, focus groups uncover dimensions of understanding that are often inaccessible through individual interviews or surveys, making them a vital tool in health research. Purpose of focus group discussions. Focus group discussions serve as a qualitative research method for gaining insights into people's knowledge, perspectives, and attitudes about specific issues. They are particularly effective in exploring the reasoning behind behaviors in ways that direct questioning, such as one-on-one interviews, may not achieve. Key features and benefits. 1. Access to everyday communication. A. Group discussions allow researchers to observe natural forms of communication, such as jokes, anecdotes, teasing, and arguments. B. This dynamic interaction can help uncover attitudes and perceptions as they are developed through exchanges between group members. 2. Exploration of social contexts. A. Focus groups are especially valuable in healthcare and medical research, where many health-related issues are shaped by social environments and interactions. B. They provide a platform to examine health behaviors, attitudes, and perceptions within their social context. 3. Tackling sensitive topics. A. Focus groups are effective for discussing sensitive or hard-to-access issues, such as mental distress, HIV/AIDS, or sexual health. B. The group setting often creates a supportive environment, encouraging participants to share their experiences and insights. 4. Assessing public experience and understanding. A. Researchers can use focus groups to assess public understanding of illnesses, health risks, and the perceived causes of diseases. B. These discussions are useful for identifying ideas and concerns related to health behaviors and dangers. 5. Gathering insights for healthcare improvement. A. Focus groups provide an avenue to explore patient and provider experiences, attitudes, and needs. B. Insights gained can inform improvements in healthcare services, medical education, and professional development. Applications in healthcare and medical research. Focus groups have been widely used in health and medical research to explore 1. Health behaviors and attitudes. A. People's attitudes towards smoking and exposure to secondhand smoke. B. Understanding local terminology for symptoms or diseases. C. Exploring perceptions of sexual abuse and related factors. 2. Sensitive health issues. A. Needs of marginalized populations, such as LGBTQ+ communities. B. Psychosocial issues faced by patients. 3. Health services. A. Professional responses to changes in healthcare management. B. Developing strategies for enhancing medical education and professional growth. Focus group discussions uniquely capture dimensions of understanding and social interaction that are often inaccessible through other data collection methods, making them invaluable for qualitative health research. Procedure for conducting focus groups. Conducting a focus group is a resource-intensive process that requires careful planning and execution. The steps involved are as follows. 1. Formulating research questions. A. Define the purpose of the focus group clearly and identify the research objectives. B. Develop specific questions or themes to explore during the discussion, ensuring they align with the study's goals. 2. Developing protocols. A. Create a detailed focus group guide to standardize the process. B. Include core questions, potential probes, and discussion flow. C. Establish ground rules for participant interaction to maintain respect and inclusivity. 3. Soliciting participants. A. Identify and recruit participants relevant to the research topic, ensuring diversity or specific characteristics as needed. B. Use targeted outreach methods such as advertisements, referrals, or community networks. C. Over-recruit by approximately 20% to account for potential no-shows. 4. Arranging the venue. A. Choose a location that is neutral, accessible, and comfortable for participants. B. Ensure privacy to encourage open and honest discussions. C. Set up the room to promote interaction, such as in a circular seating arrangement. 5. Facilitating the focus group. A. Begin with introductions, explaining the purpose, confidentiality measures, and session structure. B. Encourage participants to introduce themselves, potentially using pseudonyms for anonymity. C. The moderator guides the discussion, probes for clarification, and ensures all voices are heard. D. Use non-biased language and avoid influencing participants' responses. E. Summarize key points before transitioning between topics. 6. Transcribing the data. A. Produce a verbatim transcript of the discussion, including nonverbal cues where possible. B. Compare transcripts with handwritten notes to fill gaps and ensure accuracy. 7. Analyzing the data. A. Coding. Categorize data manually or with software, example NVivo, Atlas.t. B. Descriptive analysis. Document what participants said without interpretation. C. Interpretative analysis. Identify themes, patterns, and relationships to generate insights. 8. Reporting the findings. A. Present findings with context, emphasizing group discussions rather than individual responses. B. Use direct quotes to illustrate participants' perspectives while maintaining anonymity. Times highlight recurring themes and significant variations. Discussion guide for focus group discussions. The discussion guide is an essential tool for ensuring comprehensive and efficient data collection in a focus group. It provides a framework for the moderator to facilitate the discussion while allowing flexibility to explore emerging topics. Purpose of the discussion guide. 1. Ensures all critical topics are covered during the session. 2. Serves as a reference for the moderator to stimulate conversation without dictating it. 3. Helps maintain the logical flow of discussion, moving from general to specific questions. 4. Facilitates the collection of open-ended, unbiased, and rich qualitative data. Structure of the discussion guide. 1. Introduction. A. Welcome participants and outline the purpose of the discussion. B. Provide a brief overview of the topic and ground rules for the session. C. Encourage participants to speak freely, emphasizing that there are no right or wrong answers. 2. Warm-up questions. A. Start with simple, non-threatening questions to build rapport and ease participants into the discussion. Example. A. Can you tell us a little about your experience with general topic? B. What comes to mind when you think about key issue? 3. Core questions. A. Focus on the main topics of the study. Begin with broad, open-ended questions and progress to more specific ones. B. Example. A. Broad question. What are your general thoughts on accessing healthcare services? B. Specific probe. What challenges have you faced when scheduling an appointment? C. Further probe. Can you describe any specific barriers you've encountered, such as location or timing? 4. Probing questions. 1. Use probing questions to delve deeper into participants' responses. A. Can you explain that a little more? B. Why do you think that happens? C. Can you provide an example of what you just described? 5. Emerging topics. A. Allow flexibility to explore unexpected but relevant topics that arise during the discussion. 6. Closing questions. A. Summarize key points discussed and ask participants if they have anything additional to add. A. Is there anything important we haven't discussed that you'd like to share? B. Do you have any final thoughts or suggestions on this topic? Design considerations. A. Question characteristics: open-ended, clear, unbiased, and non-leading. B. Flow: logical progression from general to specific. C. Flexibility: adaptable to incorporate spontaneous yet relevant topics. D. Pre-testing: conduct mock focus groups to refine the guide for clarity and effectiveness. If you want to like this type of video, please like and subscribe our channel. Thank you.